Researchers in Pakistan conducted a study of 80 employees in 7 industries who work with volatile organic compounds. The goal of their study was twofold. One, they wanted to determine if there was a correlation or relationship between the concentration of VOCs in the blood and workers' experience, working hours, and workplace conditions. They also wanted to determine if there was a correlation between the presence of VOCs in the blood and any health issues that the employees stated that they were having as documented on a health survey. This study is particularly interesting since 30 of the 80 employees being monitored are printing press industry employees. Also, 2 of the 5 VOCs, isopropyl alcohol and ethyl acetate, are commonly used in the printing industry and Amcor specialty cartons. So when we look at the results of the study, we find that of those employees within the printing press industry, 15% showed levels of isopropyl alcohol in the blood. 0% of those printing press employees showed levels of ethyl acetate in the blood. Now, when we look at the overall study, meaning all 80 employees and all 7 industries, we find that there's a very strong correlation between the concentration of isopropyl alcohol in the blood and worker experience and working hours. We see that there's a strong correlation between the amount of isopropyl alcohol in the blood and workplace conditions. With ethyl acetate, we find that there is a moderately positive correlation between the amount of ethyl acetate in the blood and worker experience, working hours, and workplace conditions. Now, when we look back at isopropyl alcohol, we see that there was a strong correlation between the presence of isopropyl alcohol in the blood and symptoms or diseases of skin irritation or allergy, throat irritation, dizziness, weakness, and diabetes. With ethyl acetate, we find that there was a strong correlation between the presence of ethyl acetate in the blood and the disease of diabetes. This is only one study, but it is a good reminder for us to ensure that our operational controls, like ventilation and catalytic oxidizers, are working properly and being properly maintained. It's also a good reminder for us to wear our PPE where required and report anytime we are feeling ill to our supervisor.